Radio Voice of Naija, transmitting on 105.2 MHz, Itan 103.8 cable. We are discussing this hour on critical issues in the reproductive health of men and women. As an introduction, in this segment, we are featuring a special health segment which will be very beneficial for men and women. Special health segment, beneficial for men and women. Our guest today, Dr. Mollynn Mugisha, a general practitioner, has some very important information to give to our listeners on the reproductive health of men and women. She is a migrant trained in Uganda and has been living and working here in the Netherlands. We encourage all our listeners to tune in for this exciting program, and comment and remark and question are more than welcomed. Dr. Mollynn Mugisha is a medical doctor from Uganda and has been living in Netherlands for 6 years. She has been active giving talks and trainings to community groups, raising awareness on health matters affecting migrant communities and how we can prevent them with good health habits. She also trained people on how to build for themselves financial freedom using different opportunities around the world. So as you can see, our guest today is really versatile in the health side and at the same time the financial side. So Radio Voice of Naija, please help me welcome this hour our own Dr. Mollynn Mugisha. Welcome, please.
Thank you very much, Apostle Helen.
Awesome.
Thank you, thank you.
Are you glad to be
I'm
here?
I'm very happy to be here. Thank God.
Awesome, awesome. We're also glad to have you. At least you are a blessing to our migrant community. So you are a blessing not just only to the migrant, but to all the listeners who are hearing you from diverse nationalities. So it's a privilege to have you this morning here.
Thank you.
So tell us, which are the crucial reproductive health issues confronting men and women today that you have noticed in your profession?
Thank you very much, Apostle Helen, and I must say this is a good opportunity to be able to discuss these things. In my experience in Netherlands among the immigrant community, I have actually realized that the problem that we have are not different from anywhere else in the world. Okay. Women are women everywhere and men are men everywhere. So the most common are the problems that people even forget about, because my experience has shown that a lot of people have become used, especially the migrant community, to living in a low state of health. Okay. So some of these things we talk about, they don't even know their problems.
Really?
Yes. So talking about gynecological problems, why I find it important that we talk about this is because 83% of women, especially migrant women, will have a gynecological problem of some sort.
Yeah.
And these problems to do with genital, to do with reproductive organs, and 62% of those are due to habits of the products that they use and the way that they feed, especially the sanitary products that they use.
Wow.
So why I find it important is that 63% is too high.
Yes.
So it's something that we really need to wake up to. If I may look at some of these conditions, the common ones, for example, if we look at women, things like menstrual problems, problems with menstrual health, you find that people have heavy periods and they get used to that, so they think it's normal. And itching and infection during the periods, and some people have irregular periods, so sometimes they have, sometimes they don't have. Some people have no periods at all, and that's not normal. And problems with the specific organs among immigrant communities, especially Africans and Asian women, so Filipinos, Indonesian, Chinese, we have a very high rate of fibroids. So fibroids, these are commonly called myoma,
Yeah.
flesbome. The rate is unacceptable, to be honest. And another problem with the organs is cancer of the cervix is becoming very, very unacceptably high, and polyps. So a lot of minor operations and minor visits to the gynecology are due to polyps, for example.
Okay.
And then problems with the ovary. So we're breaking it down per system, per organ.
Yes.
A hormonal imbalance. How do you know somebody has hormone imbalance? A lot of people have no periods, heavy periods, because their hormones are out of balance.
Yes.
And especially infertility.
Mm-hmm.
So we have more people now on hormone replacement treatments to increase their fertility.
Yes.
That is higher now than it was a few decades ago. And some people have early menopause. So you find some people in their early 40s, in late 30s, and they're already experiencing symptoms of menopause, which is unusual. And then low libido. I mean, coupled with the heavy work schedules of immigrant communities, it does affect their libido and their sex life, and which has put a strain on marriages.
Yes.
And you know, this is important that people actually begin to think about this, then we can discuss solutions. If we, of course, the men as well, we cannot forget that
Doctor, I think it would be nice to, I'm getting too excited in this whole thing. I don't know somebody out there, but I'm getting so excited. You spoke about, you've made mention of several things, and you are telling us here that some of the gynecological problems that women are having are connected to their menstrual
are connected to use of poor sanitary
products. Use of poor sanitary products.
Yes.
Man, this is mind-blowing.
It is, and because most people don't really think about it. But if you look back a few decades ago, say to the times of our grandmothers and of our great-grandparents, when women, when they were in their period, they used the good old cotton cloth.
No, so but I cannot, doctor, I think what they were using those days were more crude. I mean, clothes. Those days were more crude. More crude.
If we break it down to the materials, all the cloth contains is cotton, right?
Yes.
And during that time, you didn't have much problem with fertility. So, for example, how many people in our great-grandparents' age were infertile?
Yes.
How many people had fibroids?
Mm-hmm.
How many people had irregular periods?
Yes.
Very few, simply because the cloth, just cotton, is the most natural and the most clean, and it has no effect on our system. Over time, we have adopted the sanitary pads, for example.
Yes.
The most common sanitary pads have been used, and you find that what they have, actually, half the women who use them have never opened them to see what they have.
Yeah.
But what they have is just a combination of recycled, cheap chemical products. So when we use them over time, you see a trend in the rise of these problems.
Yes.
Because what we forget is that the woman's reproductive system is an entrance to the whole body.
Yes, exactly.
So if you put something, if I may give an example, when a child is sick and you want to give paracetamol, you can give the one to swallow the syrup, or you can give the Z pill.
Yes.
And when you give the Z pill, it acts faster, it is better. That's why it's advised for children.
Okay.
Because that area, whatever you insert inside that area, or put around it, is actually in direct contact with your bloodstream, with your body. So over time, when we use these low-quality sanitary pads, a lot of them have paper, which is recycled, plastic, and or tissue. So they are not any better. They are, in fact, worse than somebody who uses cotton, because they introduce these chemicals which over time change the way your system works. And so ovaries are affected, so hormone production is affected. Of course, something like candida, because a lot of them also have plastic.
Yes.
So there is no exchange of air. They kind of incubate the bacteria because it's closed in. So then you find that there is a higher rate of infection during and after the period.
Yeah.
And that affects a lot of things, because if straight after the period you have some infection, you have candida, you have experienced dryness and itchiness.
Dryness, yes.
It's an effect on your sex life, because you know everything gets affected.
Yeah.
But the sad part is people get used to these things.
And they just
live through the day and
live through the
become
day.
normal.
My God.
So it's very sad, because oftentimes you hear somebody who says, for me, my periods are so heavy, I cannot use anything else, and people use baby diapers, there's all sorts of things. So what I would like to tell the people is that, of course, it's uncomfortable to use the cloth in this day and age.
Yeah.
Of course, it's more convenient to use tampons, because people find that it's less messy, although it's not safe.
Yeah.
So I would like them to know that there are actually other possibilities out there.
Yes.
You need to go look at them. There's
Like the one you were mentioning the last time we had a business seminar.
Since 2010, January, we actually import into the Netherlands and into most countries in Africa, because most of us are from Africa.
Yeah.
We actually import a brand called Onion. And Onion has been, it has grown since 2005 that they started to make it. It has grown popular over the years because it is very close to the natural.
Yeah.
It's made of absolutely natural materials. It has some new technologies which actually make sure that you don't have an overgrowth of bacteria, that you clean your system. It cleans your system. And then it comes with it, and it has no plastic in it at all. And it comes with it a special test kit that you can actually check yourself if you have inflammation or not. This is very important because most of the inflammation that women have in their reproductive organs, you don't feel it until it's too late.
Wow.
So a good example, you don't have itch. You cannot itch inside you. You can only itch outside. That's just a crude way to put it.
Yes.
But when for example, cancer of the cervix, most of the cases, more than 90% of the cases, are diagnosed when it's too late, when it has already spread. Because when you begin to feel the pain and begin to bleed, it's already too late.
Wow.
Even in Holland, where we have free tests, the pap smear, and really, I always want to tell every woman above the age of 30, if you've not gone for a pap smear, please contact your GP, contact your house doctor. It's free, and you don't have to have insurance.
Yeah.
But even when we have it free, people still don't go for it, because generally we have a low health-seeking behavior, especially if you don't feel like it's about to kill you.
Yes.
Especially for women. If you don't feel it's about to kill you, you don't go. Some people will itch and itch and itch and bleed and consult the neighbor, consult the farmer, consult the mother back in Africa, and the house that is right next door. So go and get that pap smear.
Yes.
Even in Holland, where we have a free pap smear, people still go when it's so late, and so you end up with really operation and terminal cases of cancer of the cervix. So what this product, the Onion, has devised also, they have that test kit that you can test yourself anytime. It's free. Once you are using the product, you get it for free. You can test yourself anytime, and it will give you grades of inflammation. If the inflammation is very high, you have a very dark color change, it's a sign that go to the doctor. Don't lie around and wait, just go.
Exactly.
Because some of these things are preventable.
Wow.
Most of them are preventable.
So, I mean, can we associate the inability of the African woman to go out and get a health advice could be because of shyness? Is it a taboo to say that I'm itching? Is there any taboo around this whole thing that is restricting them? I mean, the pap smear is something that every woman is supposed to go and have anyway. So why is it that we are not responding to such tests?
It's a multitude of factors. Partly because you don't really feel that you're sick, because you're not really sick. And I've noticed with our community, one of the most difficult things to adopt is a preventive attitude. Being able to, thinking of preventing something that didn't happen yet.
Yes.
So it's just a habit, a bad habit that we have, I'm afraid to say. It goes with also insurance. You find that most Africans have no insurance because you're thinking, what if I don't get sick? Why bother? So it's just a bad habit that we have, that even if it's free, we're so busy doing all these in-between jobs, and you know, it's a busy life that you kind of push it in the background. You get the letter from the GP, say, okay, first of all, it's also in Dutch, so most people don't even understand what the letter says, so they don't even bother to read it or ask for somebody to interpret. So then we don't really see it as very important.
Really?
Because when you're not really sick, you're thinking, what is there to prevent? And some people, unfortunately, don't have the information. So they try all sorts of other things before they know they get the right information to go to the doctor. So it's very many factors.
Yeah, well, I believe that some of them even are listening to us right now. By virtue of being a reverend minister, you know, sometimes they come for counseling and they are telling you some of the hormonal changes they are having in their bodies. And yet, we will tell them, go to your GP and go to a gynae and try to get a letter from your GP to go to a gynecologist, you know, go to a gynecologist and go and check what really is wrong. Sometimes some of them, I mean, one of the major problems I think I've been hearing from them has to do with, you know, inability to have regular sexual life with their partners. And then you made mention of this low libido and whatever. So, and you related it to our stress and the job factor. How does that affect the libido, please?
So three things that you have mentioned. One is that people find it easier to talk to somebody of their kind. So people will find it easier to come to you and tell you about their sexual health problems.
Hold on, please. Hello, caller.
Press the.
Hello, caller. Yeah, good morning, please.
I wanted to contribute
Oh.
Dr. Mugisha.
Okay, you can. Yeah, she's listening. Go on.
I wanted to request Dr. Mugisha to help us break all I actually thank her for coming to contribute on this, but could have break out the terms, because most of us don't understand even the terms what she's using. The terms are very hard, but because we come from Africa, we don't understand a lot of things that the people that are here give us information. The way that she's saying, people can read the letters, we can't understand the terms she's using.
Yeah.
If you tell me gynecology, I can't even talk out the word.
Gynecological.
Yeah, that is.
So many of us cannot use the words and can't understand the words. Is it possible for her to help us explain those deep terms that she's using?
Like polyps, cancer of the cervix, polyps, hormonal imbalances, low libido, all of those things. So, doctor.
Can come to Europe, but we've not even had a chance to learn that biology. So, can we be helped to explain that? Second of all, she's told us there are very good parts that can be used, but we don't know where to find them yet.
Yes, those are the things. Actually, those are the things that she is going to still talk about. And that part, I think, would be more easier to, Dr. Mollynn. I think I'm going to bring you to the television because it will be good for the people to see you demonstrate this thing. So I'm gonna give you an airtime on my television, and then you can demonstrate that, and the people can see.
Yes,
because seeing will convince them.
Yes,
Yeah, and that is very good. But there is also one more information question. Due to our incomes and our time in this Europe life as a migrant, is it possible that she can also help us as a doctor to organize we can get together and learn more about what she's talking about. Because maybe a day or two can help us understand more than, you know, the terms are very, very hard for many of us to understand.
Well, thank you so much, Dr.
That is all I wanted to contribute. And
yes, thank you, and keep listening anyway. And in case you have more questions as we progress, just feel free to give us a call.
Thank you very much for giving me a chance.
Right. Dr. Mollynn, can you please answer?
Thank you very much, and thank you, Mr. I didn't get your name. Michael
Williamson.
Yes, thank you for that contribution, and indeed you are absolutely and 100% right that language does cause the difference in language between the medical and the non-medical does cause a barrier actually, and yeah, it is a task to always try and simplify these things. So things like gynecological, anything related to the reproduction. So I think from now I will replace gynecological with reproductive. I don't know if that makes it very easier. And then for the information sessions, yearly or monthly sessions, actually now it's what I do full-time, because I realize it's more important to find you in the community and prevent you from being sick than waiting for you in the hospital when you're sick. So that's what I do, and I request everybody who has a forum of some kind, if it's a church group, if it's a men's group, if it's a whichever group, you can actually directly approach me and we work out a schedule, and you will be surprised that most of these things I do for free, so don't be worried about the money. Just let me know, organize yourselves, and we can fit it in.
Wow.
That's very good. We were talking about the low libido and stress, and how they are related. For both men and women, sex is a very mental thing, although for some men it's also largely visual. But if you're tired, if you are not feeling good, if you're not healthy, if you're feeling dry, then you cannot be really thinking about, let alone enjoying sex. For the African men, something I would like to say really is we have come to Europe, and so a few things must change. I'm a mother myself. I'm a housewife and also a professional woman. If I were in Africa, I would have 2 maids, one for the kids, one for the house, one to clean and iron and to cook. But I'm in Europe. That's not possible. But I have a partner who is an equal contributor into the household in all aspects, not just financial, because our African men, most of them think you just provide the money, and the woman will cook, scrub, look after the children, and by the time she's done, and you will sit, watch TV or go out and drink, and by the time you come home, it's 10 o'clock, the woman is still working from morning. And then she's exhausted absolutely, and she goes to lie down and you're demanding for sex. How is she supposed to feel like anything after all that work? So that stress alone, let alone going to work and job and everything, just, you know, trying to keep things together without any extra help of maids and everything, means that unless these things are shared, it does affect the libido of the woman especially.
It's true.
And that we really ask the men to play a part, because if I'm very tired, I don't think I'll be feeling like anything, let alone enjoying anything after midnight.
It's true. It's very, very true. So the low libido is as a result of stress.
It's a big
hard work, and I wanted you to connect it to the low sanitary quality.
The low sanitary products, like I said, affect eventually the hormones, the ovaries. And our system, unfortunately, women, we have like 6 different kind of hormones that directly affect us and our libido and how we feel about ourselves, about sex. And you know, you've seen this expression, when a woman is in her period, you keep out of her way. Why? Because the hormones are out of control, like pregnant women and everything. So when you're using these low quality products for over a long time, what they introduce to you affects the balance of your hormones. And these hormones affect whether you feel good about sex, whether you produce enough lubrication to make sex enjoyable.
Exactly.
And of course the direct irritation and infection and the candida that you can have. Candida infection is one of those that causes a lot of itching.
Itching.
So if you're itching and
Yes.
you don't really feel you're dry all the time,
Yeah.
eventually women switch off about sex.
Yes.
And so they don't feel any interest in sex, and basically low libido means low interest in sex.
Low interest in sex because of the dryness of the vagina.
The dryness, the hormones are
the
also
hormones,
not enough.
yes.
You're not producing enough hormones. These hormones are supposed to kind of switch you on, make you hot, make you fiery.
Yeah, exactly.
If you don't have them, you
Yeah.
just feel low about sex.
So and then it has been noticed that women are now women of our age are now having menopause quicker than our mothers.
Yes.
So when some of the symptoms of menopause is also this low libido.
Yes, because menopause just means that your ovaries, which really make you a woman, because they produce the hormones and make you a woman and not a man, when they stop working, they start producing very little. Then you start getting effects of menopause. Like your reproductive life is coming to an end.
Okay.
So the hot flashes, sometimes you don't have periods, sometimes you have periods, sometimes they're heavy, sometimes they're light. And some people by 45, they've already shut down, nothing is happening anymore. So all those things are related to what we introduce into our body.
Yes.
Something interesting actually, because when I'm talking about introducing into our body, a lot of us are thinking through the sanitary parts, through the vaginal roots.
Yeah, exactly.
There was a research in England, I think 3 years ago, that brought an interesting dimension to this whole discussion. Especially it was looking at fibroids, which we have very commonly. And they found that there was a higher rate of fibroids in women who relaxed their hair more than 3 times a year. And almost every African woman relaxes their hair.
Yes.
Most of us do.
It is true, yes, it's true.
And what we don't realize is if this chemical is enough to burn your hair straight, it also gets absorbed in your skin, of course.
Wow.
And when it gets absorbed in your skin, it goes directly to any organ on your body. And the womb, which is our reproductive organ, is one organ that is very inactive.
Yes.
It's only active when you're pregnant. And you're only pregnant how many times in a year? So when it's just sitting there doing nothing, and you have all these chemicals coming from the cosmetics that we use, the relaxers that we use on our hair, it all goes and sits in the womb. Some people's wombs are more reactive.
Yes.
So those that are more reactive quickly develop fibroids because of that, of those chemicals that are sitting in there. So these chemicals we're talking about are not only coming from the vaginal route through the pads, also the things we put on our skin, especially the relaxer. That was amazing because, and when you think of it, when somebody has been from the salon and they've relaxed their hair, they have maybe headache, or they're very snappy, and they're very easily irritated.
Yes,
because of that.
Yes, it's
and
true.
if you go to the toilet and you pass urine and you smell it, it actually smells relaxer. Because your blood is trying to get it out of your system.
Okay.
So it means this relaxer that you have used has gone everywhere. Now that's just one example.
Yes.
How many other things do we use on our body? Bleaching, bleaching creams.
It penetrates.
They penetrate directly because the skin is a
so
living
not only
organ.
to the genitals.
No, not only the genitals.
Yeah.
Genitals tend to affect our reproductive because it's direct. It's like directly introducing it there.
Yes.
But it's anything that you put in your body that should not be there.
Wow.
And so that's why, for example, these onion pads, because they have that onion, I don't know how best to describe the term onion. It's best described as a vitamin of the air. It's from oxygen atoms.
Okay.
Because these oxygen atoms, now how can you describe oxygen? This is the air that we breathe. What keeps life going. Without oxygen, there is no life.
It's true.
So when they come to these systems, they clean out. They help us to clean out. And so it affects a lot of other things, and it's just a good health habit to clean out very regularly. So that's how it all ties together, because our body, these organs are not isolated.
Yeah.
If you eat something bad, you will have a headache. how does it get to your head yet you put it in your
but
stomach?
the system that we have now does not make it possible for even the average African woman to be able to afford onion, because onion, from the cost of aid, it can be affordable here. But what about those who are in Africa? Because whatever product that we are bringing out at this time that could help women sanitary system has to be something very, very affordable to even the rural woman in one village or the other, to be able to help them in their gynecological life, okay?
Yes.
So how do you think onion will become universally acceptable to, or will become something every person will be able to use? Because the price of onion does not permit the rural woman to be able to buy it.
That's a very
So,
good question.
Yes.
And it's a good observation, because I always say anybody who can afford, for example, what's the most common brand on the market is Always.
Always, yes.
I always say anybody who can afford Always can afford onion.
How?
Because most of the prices you will get quoted for onion are retail prices. And I say a smart person who is thinking of long-term use needs to be thinking wholesale, to buy cheaper. The only thing about buying cheaper is you need to buy in bulk.
Yeah.
So, whereas you go and buy the regular one, or a Brise or an Ethos brand, you buy it at a retail price, and you just need to buy one a month.
Yes.
But if you're to buy onion wholesale, you need to buy the whole package for the year, a month. Now that takes you putting a certain importance on your health, because when you buy it out wholesale, you're actually buying it at the cost of the regular one.
Wow.
And when I do my demos, I know there are people who will not be able to afford them. But what I want to impress on their minds is to think about it. Some of the local brands are also good, as long as they have only cotton and no plastic. And the most, also in Africa, we are using a lot of the reusable brands, which are the cloth. It's actually quite good, and I encourage people to think more to those, because it's not contaminating you in any way. So eventually, Always, actually, if you look at Africa now, the turnover of use of onion in Africa has gone much higher than in Europe.
Wow.
Simply because in Europe we are deceived by the whole thing of insurance. You know, if I get sick, I get treated for free. Well, not for free, because you pay insurance. In Africa, if you get sick, you're on your own. You have to find a way to treat yourself.
It's true.
So people are taking prevention more seriously in Africa. And so they are adopting more healthier habits. Those who can't afford onion are using cotton, and they're using the reusable ones, and then they're reducing their risks very greatly. So in the end, anybody who can afford Always, or Librise, or Ethos, or Crowdvat brand, can afford onion if they buy wholesale. They just need to contact their distributor and tell them they want to buy wholesale. You pay €70 for 1 year. That's not much, actually.
No. Well, that's good. Well, if you are listening to this broadcast and you may want to react to what Dr. Mollynn is saying, or you have something to add, or you have a question, give us a call on 027-371619. Now, concerning Dr. Mollynn being in any of your social event, her telephone number will soon be revealed. Otherwise, you also go to Radio Voice of Naija, our website. You will see her telephone number there, and then you can always book her for your social events. By the way, Radio Voice of Naija will be having our event any of these days, and I think we would like to have Dr. Mollynn as well come and demonstrate this onion tent, so that people can see. And those of you also who may not be available at this Radio Voice of Naija evening social event, you can also log on to Majesty TV. We are also going to showcase this product there, courtesy of Dr. Mollynn. Now, we've spoken much about women. Can we go a little bit over men? So, what causes infertility in men?
Mainly, like I said, for the women, it's mainly the hormones and the inflammations. For men, of course, they are not using any sanitary pads, so they have no much chemicals in them. but men are mainly affected by the way the system runs, because for them to be able, first of all, so we're going to talk about the things that are preventable. Not that if you are born without ability to produce sperm, that's different, that you cannot prevent it. But for the men, things that affect how their blood moves, their blood circulation.
Okay.
So for example, diabetes. Diabetes will affect how you function. And so that will cause, also will cause you inability to be able to perform the act that would cause you to produce children.
Wow.
And some infections, of course. If you have repeated infections, prostate gland infections, can affect the quality of your sperm and the amount of the sperm that you produce.
Yes.
So then you cannot make anyone pregnant.
Yeah.
One thing that dominates when you talk about men's health, and of course hypertension, high blood pressure, will also affect a man's ability to perform. One thing that comes out a lot for the men, and that I would like to emphasize for the men to look out for, especially those above the age of 45, is the prostate gland.
Okay.
Now, I know Mr. Michael is listening, so I have to simplify this. The prostate gland, and many other people, to be honest. The prostate gland is one of those, it's a small gland that also sits around the tube where when you pass urine, and of course when you pass sperm, where it comes out. So how it naturally gets larger with the age. So that's a natural process.
Okay.
Although that process of the prostate gland getting larger can be accelerated by other factors, poor nutrition, and infections, bladder infections. However, how do you know that your prostate gland is actually getting enlarged? Because in some men, when it enlarges, it can turn into prostate cancer.
Yes.
But how you know, for example, when you are a young boy, and this is a game boys play.
It's true. They have to urinate.
They have to urinate a very high stream, like a jet of urine at a further distance.
Yes.
As you grow older, when it becomes larger, because it is pressing on that tube through which the urine comes, you find that you cannot do that anymore, that you pass the stream right next to, under your feet nearly, and you have to stand right next to the toilet to be able to do a good job. So that is a sign, and it's a natural process, like I said.
I'm going to try the one with this.
It's a sign that your prostate gland is enlarging.
Okay.
Now, what effects does that have? The effects it has, besides the effect on your libido and all that, is that because the urine cannot come out easily, your bladder does not become completely empty.
Yeah.
So you have more and more urine staying in your bladder. And for anything that stays for a long time, that it becomes liable to infection.
Yeah.
So then if your hygiene is also not very good,
yes,
then you have bladder infection.
Wow.
So you find that in men above 50, and of course it depends how your health is, they have repeated bladder infection. So if you go to the doctor, they say you have a urinary tract infection or UTI. It just means that you have infection in your bladder, or in that tube through which you pass urine.
Incontinence, is it?
Well, urine incontinence is if you can't hold the urine, that it keeps coming out on its own.
Yeah.
That can also be a sign of bladder infection.
Okay.
Unfortunately for the men, if it is related to the prostate gland, normally you cannot pass urine at all. So you find that in extreme cases they have to put a tube in it.
Yes.
And when I go telling men, and I tell them, you know, actually we have also onion for the men. And they find it very funny. They say, how am I going to wear? Am I going to wear a sanitary pad? I say, no, you're going to wear a panty liner. Because like I said, the negative ions in it have an anti-inflammatory effect. They have a bacterial reducing effect.
Yes.
So if you are a man and you have that kind of problem, where you have had, if you've had like 2 or 3 times urinary tract infection or bladder infection, I would strongly advise you to wear the panty liner, the liners. You wear it in your underwear like anybody.
To avoid the droppings?
To avoid the infection and to avoid the speed at which your prostate gland is enlarging.
Wow. Because
once you start getting those infections, they are very difficult to get rid of. You treat, 3 months later it's back, and 3 months later it's back. And if you think
is it a hereditary problem, or
no, not
or
really.
Is it You understand my question?
It's just one of those things that become more regular when you get older.
Okay.
Because the gland inevitably enlarges.
Yes.
But if it gets repeatedly infected, then it becomes a serious complication. And in some men, you find that maybe 3%, I think about 3% will get cancer of the prostate gland.
Yeah.
And that is actually quickly becoming one of those things that kills a lot of men. So one thing is, for men, you can have a check. You know, for women, we have the pap smear.
Yeah.
For men, when you go for a regular check, ask for them to look at your prostate gland.
Prostate gland.
Yes, prostate gland. It's an unpleasant test because they have to put a finger in your anus.
Oh.
But then, because you can then feel it and see if it's healthy or not.
Jesus.
Because if it's not healthy, it can be removed. If the prostate gland is not healthy, it can be removed. So you must, men also, I advise, if you're above the age of 50, please ask for a prostate gland check from your doctor. Just say, I want you to see how my prostate gland is. They cannot refuse. They owe that to you. And then if it's healthy, then you go home happy. If it feels a bit rough and a little bit too big, then you can begin to think of doing something about it.
Thank you so much, Dr. Mollynn. And because of our time now, would you mind telling our listeners how you may be contacted, please? Should anybody out there is listening and they may want to contact Dr. Mollynn?
Yes, I can be contacted by email, by telephone, and people who have WhatsApp, because nowadays it's becoming very popular. You can contact me also on WhatsApp. And if you want to use telephone contact, it's 0652 447347.
Okay.
So 0652 447347. And you can also contact me by email. So for email, you can contact me on Mollynn. So that is MOLLYNN3@yahoo.com. And I really welcome, you know, your questions and your sometimes you're worried. And to be honest, as far as health is concerned, there is no silly question.
At all.
There is no stupid question. If it worries you, it's important.
Yes.
If you feel unsure about it, it's important. Just ask. And one thing I like to say also, ask somebody that is knowledgeable in what you say. Don't go ask your neighbor if you have itch.
Exactly.
Because they give you all sorts of funny remedies and everything. So ask somebody who is actually knowledgeable so that you can get the right information.
Well, thank you, Dr. Mollynn, for being with us, and we hope to have you again and again and again. As you can see, we have ample of questions for you here, but unfortunately we couldn't really do much. But thank you for your time, and we hope to have you again and again.
Thank you.
Thank you for being with us.